Keep for staying with us. Now, this is one conversation I'm quite interested in because I'm looking forward to learning health and well-being. We have Dr. Micah Nabukuo-Okwa, who is a medical doctor, public health researcher focused on cardiovascular health and hypertension prevention. Hello, doctor. Are you there? Can you hear me?
Yeah, absolutely can hear you.
How are you doing?
I'm okay. How are you doing, so?
I'm good. Good morning. Let's get straight into it. How dangerous is hypertension, as it were, for those who are not very sure or who don't know?
Okay, so hypertension is a silent killer because the most common symptom of hypertension is no symptom at all, and that is why it is quite dangerous. So usually, people often come down with complications of hypertension before realizing that they have hypertension, and that has sort of like been my inspiration behind focusing on preventive cardiology, doing research that are aimed at identifying risk factors early before so that identifying risk factors early in order to treat people and prevent them from coming down with complications associated with hypertension. And
right.
yeah, okay.
All right, go ahead.
So what particularly inspired me to like focus my work on hypertension and cardiometabolic risk is that as a medical student, as a young doctor, my experiences with patients at the bedside formed a foundation or inspired my foundation to pursue this particular field. So as a young doctor in Nigeria, I kept seeing patients coming, not early, not for checkups, but at the point where things had already gone wrong: stroke, heart failure, kidney disease. And what struck me was that many of these diseases or these cases were preventable. And you would ask these patients, have you ever been told your blood pressure is high? And the answer I would often get is no, or even if they knew, nothing had been done about it. And that stayed with me. And so I began asking a different question, not just how do we treat cardiovascular disease, but how do we catch it before it becomes a crisis? And that question has shaped my research up until today. And for example, in one of my recent studies that has been published in a reputable journal, Plus Global Public Health, we looked at triglyceride glucose index and found that it could help identify cardiovascular risk even in people who might appear clinically stable, that is, people that appear relatively well. Another study that was published in BMC Public Health, we showed that a large proportion of individuals with hypertension in Lagos, which of course is the starting point of my study, were either undiagnosed or not adequately managed, which really highlights how big the gap is in early detection. Now, currently at Yale, I'm building on that and combining clinical experience with epidemiological methods to understand the risk earlier and at scale, because at the end, the goal is simple. We shouldn't be meeting patients for the first time when they're already in crisis. We should be identifying risk years before they actually happen.
Doctor, there are so many things I want to ask now, but there was something you mentioned when you spoke about the index. That means that there are some people who have a higher susceptibility to cardiovascular diseases than some others. Who are these people who have this higher susceptibility? Who are these kind of people?
Okay, so thank you for your question. So yeah, there are a lot of factors that predispose people to being susceptible to like cardiovascular disease, and one of those risk factors are I like to like classify them into those that are directly medically related and those that are not medically related. So for instance, just for starters, this cardiovascular disease we're talking about include heart failure, stroke, kidney disease, and the risk factors are like hypertension, diabetes, like high glucose, and elevated lipid levels. So now these are largely medical conditions or medical risk factors for these cardiovascular complications. And there are some people that by virtue of their zip code are more at risk of developing cardiovascular problems as opposed to some others. And that was what inspired my my development of a standard assessments platform called SA Health Assessment, which I'll be talking on later as we go on in this conversation. But largely, yes, risk factors like people that have perhaps family history of hypertension, family history of diabetes, family history of elevated lipid profile, people that are obese, people that live sedentary lifestyle, are at higher risk of coming down with cardiovascular complications and some others.
All right, wonderful. I know that many people understand curative. So let's do preventive. Let's very fast so that we can talk about that particular platform which you are building. Let's do preventive as much as possible. What are the few pointers I can give to people? Preventive measures that one can take no matter your predisposition, as it were, or your susceptibility rating, as it were. What preventive measures can any and everyone take?
Okay, so one of the easiest prevent, I would not call it easiest, but the basic preventive measure that anyone can take is lifestyle modification. And lifestyle modifications like cut across a wide range, going from like watching what you eat, trying to exercise more frequently, cutting down on smoking, alcohol consumption. So yeah, largely those are non-pharmacological or non-drug related, as every other person would understand it as, ways of sort of like reducing your risk factor. Why there are some risk factors that are non-modifiable. For instance, as you get older, you are more likely to develop certain conditions, right? And seeing that you have, let's say, generational or family history of diabetes, those are like non-modifiable factors. But then we can help resolve the modifiable factors, and that can reduce the risk of coming down with cardiovascular complications.
Okay.
So yeah, in addition to the lifestyle modifications that I highlighted, so early treatment of risk factors like hypertension, diabetes can help reduce the risk of these risk factors translating or transitioning into more serious cardiovascular complications.
All right, Doc, not so many of us have our family history. In
Okay.
fact, you are talking about what if an issue. So people are talking about a DNA test, about how high the rate of you have people who are not actually people's parents. So you might even have a family history that is not even really your family. You are smiling, doctor, but you understand what I'm saying, right?
Yeah,
Now, for
absolutely.
most of us that we know, okay, well, at least we look alike. Me and this man that I say is my father, we look alike. I look like his father's father, but I don't have his medical history. How do I know that I am predisposed to this thing? And then in a case where my mom did not want to say what happened, but I'm not from this family, situations like that.
Okay, so one of the challenges we face in Nigeria is problem with screening and preventive measures. Now, standard medical practice requires that certain investigations should be conducted on individuals when they reach certain age. For instance, when you are age 30, you should at certain intervals check your blood glucose level or your lipid profile, right? And from time to time go for medical checkups. And that is not a practice that is quite popular in Nigeria. And that is
At
why
all.
in one of my studies I did with a mentor of mine, Dr. Kasima Amadi, we did look at insight from an opportunistic screening, and we looked at hypertension in Nigeria and found out that there's a large proportion of individuals in Nigeria that actually have hypertension and do not know that they have hypertension. And even those that know that they have hypertension do not take treatments quite seriously. And so, why it may be difficult for some people to be able to identify or trace their family history or family tree to be able to identify risk factors, a more proactive approach or a more proactive attempt at prioritizing, yes, these risk factors will sort of reduce anyone's risk of
All
coming
right.
down with cardiovascular disease. So,
Wonderful,
yeah.
wonderful. Doctor, let's see how fast we can go through this because we might wrap up very soon. Let's talk about that platform. You said you put something together while you are doing this
Yes.
research and study at Yale. You put something together. Let's talk about that.
Okay, so the platform is called SA Health Assessment, and this assessment started from a simple frustration. So in clinical practice and even in research, we often wait until risk becomes obvious, until blood pressure is clearly elevated or complications have already started to develop. But cardiovascular disease doesn't begin at that point. It builds quietly through patterns, trends, metabolic signals over time. So I wanted to create something that could see those patterns earlier. And what began as a basic risk check tool has now evolved into an AI-enabled preventive cardiovascular intelligence platform. It doesn't just give you a static score. What it does is it tracks how your risk is changing over time using things like blood pressure, lipid levels, and glycemic markers to identify early cardiometabolic patterns. So you can follow these changes over 30, 60, or even 90 days. And more importantly, it translates this data into simple, actionable insights, so it's not just useful for researchers, but important for clinicians and patients. And I think that's a real shift in medical practice, helping people to know you have these risk factors and this is your likelihood of developing this complication. And we are moving from reactive care to intelligent prevention. That's where we are right now in
All right.
medicine, where we
Dr.
don't wait
Micah.
for disease to
Dr.
detect.
Micah, do
Okay.
you know what? I host a tech segment. We will talk about this particular product which you have. Since you said it's AI enabled, right? We'll talk about it.
Yeah.
Maybe sometime next week we'll reach out to you and we'll have more time to spend to talk about it and how people can utilize it to enable to get their help up. Thank you so much very much, Dr. Micah. This was quite enlightening and informative.
Thank you so much.
Thank you very much. All right, that's it on quite that discussion there. We would continue on this, I bet you we would. We'll take a time out now. Stay with us. There's still more to come on the show.